Presentation of two anterior derangement patients. Patient 1 is day 2. We'll also see the follow-up treatment at 2 weeks. Patient 2 is day 1. We're now about to see patient 1, a 20-year-old nurse. Of low back pain. Note the rather large lordosis. Can we turn you to face the door? Okay, and just place your hands by your side. And no relevant shift. There is evidence of a slight left lateral shift, but not relevant. This is Fiona's second visit. She's been sent home to do flexion in lying and flexion in standing. 2 days ago, Fiona's flexion was grossly limited, and so was her extension. After 2 days of flexion in lying and flexion in sitting, Fiona will now bend forward. She could reach her hands to knees, and now she can reach to the ankles. And back up, Fiona, please. Notice the curve does not reverse. Hands in the small of your back, and bend backwards, please. Far as you can, far as you can. And quite a good extension range. Good. And back to neutral. And again, flexion. 2 days ago, she was hooking to the right in flexion, and now fairly straight. And up the come, Fiona. And hands in the small of your back. And bend backwards, far as you can, further, 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 and a good extension range. Have you any pain in this position, Fiona?
No, not at all.
Fiona has had persistent low central backache for 1 year. She has not been free of pain for more than a few minutes or a few hours in each day. Now we're going to place Fiona in a sustained extension position. Just place Fiona in a sustained extension position, and we're going to leave her there for 2 to 3 minutes. What do you feel in this position, Fiona?
Lower back side.
And as you lie here now, what's happening to the pain?
It's getting worse.
And where is the pain?
Lower back.
Nothing into the buttocks?
No.
Fiona presents as a classic derangement 7. With sustained extension, what we expect to see is a gross loss of flexion and an inability at all to move into flexion due to the blockage. We'll then place her into supine lying and ask her to do flexion in lying, and we'll see a rapid reversal of the flexion loss. And in this position now, Fiona, what do you feel?
The pain is getting very worse.
And is this your pain that you've been suffering from for a year?
Yes.
Sustained extension for about 2.5 minutes. Now, Fiona, could we stand you up off the bed and try and keep the arch in your back as you get off? The best you can. We're going to try and maintain Fiona's lordosis until she stands. And now we'd like you to face sideways, Fiona, please. And same again. What do you feel in your back?
It's very sore.
Now, just bend forward and try and touch your toes.
At there.
Can you go any further?
No, it's going to hurt.
Further as you can.
Oh.
And you can see Fiona's now locked.
Oh.
Try and go further. How much pain?
A lot of.
And where's the pain?
Just one for the day.
Right, and then stand back up.
Oh.
And you can see the classic increased lordotic posture. We're now placing Fiona back on the bed. I'm going to ask you to do flexion in lying. Can you bring your knees to your chest, Fiona, and just gently pull down? You can see there's a limitation of flexion in lying. And then down again, just pressure on, pressure off. Nice and slowly. And we should gradually see an increase in the flexion range. Nice and slowly. What's happening to your pain, Fiona?
It's gradually down.
Good pull, right down, pressure on, and then pressure off, and relax. Pressure on, good pull, and pressure off. That's it. Hug them to your chest. Right down, keep the knees together, that's it. And you can slowly see an increase in range. In that position, what do you feel?
I still get at times it's getting better.
Good, away you go. Nice and gently. Pull, right down. Good. And what's happening to your pain?
Gradually down.
Good pull, right down. Further, 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 further. Good. Good pull. Good, good. That's it. And what's happening to the pain?
It's back on.
Good pull. Right down. Further, 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 further. Good. And again, good pull. Hug them to your chest. Pressure on. Good. And pressure off. And now what do you feel?
Pain zero on.
Away you go. Just do a few more. Good pull. A few more repetitions. Flexion in lying, and I've actually added all the pressure. Now Fiona, can we turn you sideways again? And we'd like you again to bend down to touch your toes. And right down as far as you can, further, further, further. And what do you feel in that position?
Oh, it's going to be done.
And in your back?
Nothing.
Good, and back up. And hands in the small of your back, and then backwards, as far as you can. Further, 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 further. And no block to extension. And then down to touch your toes one more time. There we go. Further, 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 further. Good. And then back to normal. Thank you. And how much pain do you feel now?
None.
To demonstrate flexion in sitting. Where you go, Fiona. Right there, hands around the front of your ankles. And pull down, further, 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 and then back up. And just repeat that 10 times. So Fiona's home exercise program at the moment, after 2 days, she's been repeated flexion in lying 10 times every 2 hours, and she's been doing flexion in sitting 10 times every 2 hours. How much pain have you had in the last 2 days, Fiona, compared with over the last 6 months?
Hardly any at all.
Good. We've also told Fiona to sit slouched and not maintain the curve in her back. Down as far as you can, hook down, good, and then back up. Excellent. How many's that?
I don't know.
Right, we'll stand you up. Can we stand you up again? Have a look from the side. Now, can we bend you to touch your toes one more time? And then back up. Good. And just standing there now, what do you feel?
No pain again.
Good. You'll visit. As you can see, there's a reduction in the lordosis. Can you bend forward to touch the floor, please, Fiona? You can see there's a massive improvement in flexion. And then back up. And hands in the small of your back. And bend backwards. Or if you can, further, 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 further. Good. And back to normal. And the extension range is free. And down to the floor again. Good. And back up. And just relax. How much pain do you feel today, Fiona?
None.
Now, out of 100, when you first had the pain, before you came to visit here, what would you give your score of pain on intensity?
Oh, 60 to 7.
And now?
Oh, 15.
And what are you doing? Are you doing more activities?
So definitely more activities, looking more around home and doing a bit of gardening and helping out on the farm.
And these are things you couldn't do before?
No, none of them.
And how frequent are you having the pain now compared with before you came here?
Oh, very irregular. It's just sort of every now and again if I do too much outside or something like that.
And how do you get rid of the pain?
I do my exercises when it goes.
Good. As we can see here, Fiona still has difficulty slouching. Now we'll sit you up nice and straight, put the curve in your back, and then slouch. And again nice and straight. What do you feel in that position, Fiona?
Nice and straight?
Yeah.
I feel a little bit uncomfortable.
And then slouch. And in that position, what do you feel?
I feel fine.
That feels comfortable.
Yeah.
Away you go, Fiona. Fiona's now doing flexion in sitting. And then back up. And do you want to hold up to the chair legs, Fiona? You can pull through, right through. Just pulling through on the chair legs. And then back up. Fiona still finds that she gets stiff and still has some flexion loss. Not as much pain, but she gets a stiffness. In fact, she was complaining of stiffness today. Which we're doing repeated flexion lying, followed by flexion sitting, and then flexion standing. So you can regain the range of movement. Now, can we stand you up, Fiona? So you slide the hands down the legs, and we'll bend towards the floor, and just do about 5 or 6. And as you're doing this, what do you feel?
Nothing.
No pain.
Okay.
That's it. Now this time stand up straight, place the hands in your small of your back, and bend backwards, as far as you can. And what do you feel?
No pain.
Good. And then just relax. In the flexioning standing, and we can see that you can now place the knuckles and flat hands on the floor. There we go, Fiona. Just do a few more repetitions. There we go. Excellent. You can still see the back's fairly flat, which is not moving much in the lumbar region, but it's a vast improvement from what it was. What do you feel, Fiona, now in the lower back?
No pain.
Just a few more. Slide right down the legs, past the ankles, that's it, and there we go. Good. And now hands in the small of your back, and then backwards. Further, 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 and you can see extension remains free. Good, thank you, Fiona. Standing posture correction. And now just relax, Fiona. Let your arms out, that's it. Now, tip your pelvis backwards and tuck your bottom in, further, further. We're trying to get Fiona to stand with a reduced lordosis. She's finding it quite difficult. And relax. You can see how the lordosis increases. And then tip your bottom under and pelvis back. That's better. Now hold that there. Fiona thinks this feels very uncomfortable. Just see if we can reduce the lordosis. And relax. And again, tip the pelvis back, tuck the bottom under, chest high. Good. What do you feel in that position apart from uncomfortable, pain-wise, Fiona?
No, no pain.
Good. And relax. And again, tuck under, tip back. Good. We're going to try and get Fiona to educate herself to reduce the lordosis. A 35-year-old care assistant. This is day 1. Now, can you just turn sideways?
This way?
And just place your hands slightly forward. Note the accentuated lumbar lordosis. And now I'd like to run your hands down the front of your thighs to touch your toes. As far as you can.
I can't now. It's moving now.
Can you go further?
No.
And then come back up. Place your hands in the small of your back. Just palms facing down. and bend backwards as far as you can. Further, right back, further, 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 and back up. And just hands on the front of the thighs and bend down forward. And then relax.
Right up. Right there.
Now, just going to perform knees to chest. Pressure on and then down. Pressure on, pressure off. Just repeat that several times. As far as you can each time. Further, 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 further. And down. And again. Pressure on. Pressure off. And as you're repeating that now, what do you feel in the back? In this position now?
Only very on the left side, very small, in the middle of my back, a little bit of pain.
And then down. And again. And as you're repeating it, what's happened to that pain? More and more, less and less, or just the same?
About the same.
And again, further, 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 and down. Keep going, nice and gentle. Further, 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 further. That's it. Try and get the knees right to your chest. As you're repeating this movement, what's happening to that pain? More and more, less and less, or just the same?
Forgetting about it, yeah.
It's easing. Continue. Right up, further, 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 right up, pull those knees, and then down. Pressure on, pressure off. Pressure on, pressure off. And again, pressure on, pressure off. Pressure on, pressure off. Good. Now can you come and stand up? In flexion in lying, can you place your hands on your thighs and bend, touch the toes? There you go. Further, further, further. Good. And back up. How much pain?
No, I was under my legs.
Just stretching at the back of the legs.
Yeah.
And down again. There you go. Further, 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 and back up. How much discomfort?
Nothing.
No pain?
No,
Down you go again. Both legs, that is, stretching at the back. Is that stretching the hamstrings?
yeah.
And back up. Now we're going to sustain the patient an extension for 3 minutes. Lying in this position now, what do you feel?
Comfortable.
Any discomfort in the back?
No.
Note the large range of extension. We've sustained the patient in extension for 2 minutes. And now we're going to ask you, could you stand up off the bed without losing the arch in the back? Can you just stand up? Try and keep the arch in the back. And we're going to stand you against the wall again. What do you feel? Any discomfort?
No, it's all right. Oh,
We'll turn you sideways again.
shall I keep the arch?
Yep, keep the arch just for now. Now, hands on the thighs. Down you go. As far as you can.
I can't go any further.
Keep going as far as you can. What stops you?
I don't know, my back.
Is it painful?
Yeah, a little bit.
Whereabouts? And then stand back up. So we've been able to accentuate the lordosis and block the flexion. One more time, just bend. What stops you?
Probably my back. Oh!
And then back up. Now we're going to reverse the process. We're going to put it back on the bed and do flexion in lying. Press your arm. What do you feel? Press your off. Just repeat that several times. Press your arm. Press your off. What's happening to the pain? Press your arm.
It's not there, it's only that little nagging, just a little bit.
And when you're there, press your arm. More or less
It's
pain.
better, more when I'm going like that.
And when you come down,
Yeah. No, it's gone.
Yeah.
It's gone.
away you go. Press your arm. Pull up. Further, 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 further. Press your arm. And again, press your arm. And again. We're going to repeat this and then do some focused overpressure, and we'll show reflection improvement and decrease in pain. Chin lying, and place your hands on your thighs. How much pain do you feel?
None at the moment.
Down you go to touch your toes, and you go further, 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 further.
That's all I can do anyway.
And then back up. Is that normal for you to go that
See if
far?
I can't go.
Any further?
No.
That's it. Pressure on, don't come too far back. Pressure on, pressure off. What do you feel as you repeat this movement?
Nothing really.
There you go, as far as you can. More the exercise.
Yeah.
Pressure on, pressure off. Right there, as far as you can go. Pull right through. Further, 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 further. Then pressure off. And again, pressure on. There you go. Further, 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 further. And pressure. Now can we stand you up? And can you bend, touch your toes? And then back up. And thank you.